So I just want to say thank you to the few people that are on with us today. This is also going to be recorded and available for future viewing. And we're just going to jump right in since we're running a few minutes late because of wonderful technology. So Sue, thank you so much again for joining us today. I wanted to just share with our audience, pardon me for 1 second because it fell on the floor. All of my notes fell on the floor in the flurry of trying to get you on. I wanted to just give a quick little intro to Sue, go over her bio really quick, a little bit about Hudson Headwaters, and then we'll jump right in. So Sue Corney is the Executive Vice President and Chief Human Resources Officer at Hudson Headwaters Health Network. She's been with the organization since 2017. She has over 25 years of experience serving in senior HR leadership positions in the medical device, insurance, healthcare, and hospitality fields. She also has experience with one of the largest international brokerage firms in the world. Her experience is very vast. She has experience with talent management, leadership development, employee well-being and happiness at work, equity and inclusion, compliance, benefits management, and she is also a licensed New York State life accident and health insurance agent. I'm assuming that probably had something to do or a requirement when you were with the international brokerage firm.
Yes.
So that's a little bit about Sue and just a little bit about Hudson Headwaters. Hudson Headwaters has providing care for over 40 years. They are a nonprofit system of 21 community health centers providing primary care to the Adirondack North Country and Glens Falls region. Hudson Headwaters is the sole medical provider in much of this rural, medically underserved region. In the Glens Falls area, Hudson Headwaters is the only primary care safety net provider. Patients are served in Hudson Headwaters local health centers, in hospitals, nursing homes, workplaces, schools, and in their homes. As a federally qualified health center, Hudson Headwaters' mission is to provide care to everyone in the communities they serve, regardless of income or insurance. Their practitioners care for more than 1,200 people per day. And I grabbed that from the website, Sue. So if there's anything about that that needs to be updated, feel free to jump in and correct me. But I wanted to give our audience a little bit of background on the vast nature of Hudson Headwaters and all of the areas you serve and the people that you touch, because I think that's pretty important. How many employees does Hudson Headwaters have as a whole?
So Hudson Headwaters, the federally qualified health center portion of our business, has about 920 employees. We have two other companies. We have a 340B company and a new PACE program, which is Pathways for All-Inclusive Care for the Elderly, which we're really excited about. So that adds about another 60 to 70. So we're close to 1,000 employees now.
Gotcha. Wow, that's a lot.
It is.
So as we talked about, and as the nature of this webinar is, it's about culture, it's about retention, and why that's so important in an environment and in a company. And obviously, the bigger a company gets, the harder it is to maintain a really healthy culture. Sometimes it drips down to a more departmental level, and each department within a larger organization can have somewhat of their own culture. So as the leader of the organization from an HR standpoint, when you came to the organization, what were some of the things that you were seeing that you knew you wanted to tackle and improve for the organization, because culture is so tied into retention of your employees?
Yeah, so when I first came, it was kind of a little bit more traditional. We didn't really have our core values established. We didn't really have a strategic plan. And probably it was more typical of how people were managed through long performance appraisals, the historical counseling and discipline. So when I came in, it was a real shift and focus on, who are we? What are we going to be about? What are our core values? And then mapping those out, getting the artwork that goes with them, embedding them in everything we do, performance reviews, incentives. So everyone here now can recite our core values, because don't tell my physicians this, but QUACS is the acronym for it, because it's quality, appreciation, creativity, and sustainability. And we really live those every day. And it's just be kind, just be nice in everything you do. 86% of my employees are also patients in the network. So it makes it really easy to just be nice to your coworkers because they're also patients sitting next to you. So shifting that culture, because we already had a really great culture here, but to your point, we grew really fast in a very short amount of time, and we're continuing that trajectory. There were 700 employees when I first started, so now to be closer to 5.5 years later, 1,000, which is wonderful. But just figuring out how do we make people happy. Everybody's different. Everyone has a different answer to that question, and that they know we're engaged. And it's no cliche. It comes from our CEO, Dr. Tucker Slingerland, who's also a family physician. So he sets the tone. He is always kind, and his motto is, how do I make this person's day better? Whether it's a patient in front of him or an employee in front of him or someone in our community, he always starts with that. And so it makes it really easy to feather that into everything you do.
So let's talk just a little bit about the culture shift and the manager's mindset. You and I talked ahead of time, and you had said that one of the biggest areas that you continue to work on with the organization is that changing a manager's mindset from confrontation, performance management, putting people on performance improvement plans, to coaching, mentoring, providing support. And I think you say it best, but something about, what can we do to keep this employee, not see this employee to the door. So tell us more about that.
Yeah. So when I first started, it was much more of the culture of, here's the occurrence policy, here's no tolerance for absence, all these things. And to me, it was just a staffing issue, because I'd ask, well, how is the person when they're here? Oh, they're fabulous. So let's just figure out the staffing. So we moved from a culture of corrective action to coaching. So don't correct, coach. And even the words you have in the forms people use, it sounds so much better to say, oh, I'm having a coaching session with you, and here are the things that'll make you successful, versus you did this wrong, you were late this day, like all these punitive things. If you switch it to be a much more, it feels better when you're giving it, and it feels better to the person, because everything you write in there is, how am I going to help this person be successful? Because if we made the decision to hire them, we want to be right, that we made the right decision. So we should do everything in our power to make them successful. So we don't terminate people lightly. We do everything in our power to make them successful. We don't focus on attendance, because we're in healthcare, right? People have health issues. They're out. There's a lot of anxiety that's new to after the pandemic. And so you can't pretend it doesn't exist. So just work with the person, and always remember, it's a human being. We're human resources. We're here to protect them and make them happy. And so we really successfully shifted to that model. And people know now that when they come to anyone on my team, it's like, how are we going to make this person successful? And that's how all our training sessions go as well.
So when you were dealing with and day-to-day deal with managers on this principle and this philosophy, I mean, how is it received? I mean, I've obviously been in situations where a manager's fed up, they're frustrated, they need work to get done, and they rely on, employees to do that work. And then we have, you might have a coaching scenario coming up with an employee. So talk about how you were able to either show the results or change the mindset of those managers to also buy into that culture for the organization.
Yeah, and in particular in New York State, we're really generous, right? We have lots of benefits, both federally and state, that employees can take advantage of. So you have to shift away, especially if it's an attendance issue, because you'll never win with New York State on that, because of all the benefits people get. So instead, I would walk the manager director through saying, let's just look at the absences you have, the openings you have, and then do the math. And I can see why you're stressed. You're really down 1.5 people. So let's hire to make sure you can cover for those absences. It's different when it's performance-based, because that's when I'll focus on, let's do retraining. Let's do different types of training. Let's mix it up. Let's have someone different train them. Let's have them go to a different center, because everyone learns differently. So it's figuring out how that person learns, how they retain things. And quite often, we typically think someone should be trained within 90 days. But when you're short staffed, it's tricky to focus on the 90 days. So if you don't spend 100% of your time training them, don't expect them to be 100% at the end of the training, right?
Yeah.
So we really said 90 days is, erroneous. Let's give them 6 months, even if it's 9 months. If they're successful, that's a win, because we don't want to start over. So it's a lot of discussion and coaching. And when someone's frustrated, I can talk them off the ledge and get them back on side. And there's many times that I will participate in the counseling or coaching with the person, because I can do it in a way that's a soft landing, and then they learn from it.
Right, absolutely. One of the other things that you and I had spoken about was developing a listening culture in the organization. Can you tell me a little bit more about that, and how, you personally are going out into the field, into the different health centers. So first, how do you establish that trust when HR is coming to the building, right? Because people still, unfortunately, HR equals, I might be in trouble. And then talk to us about how you established that cadence and what you do to promote that listening culture.
Yeah. So the old school of thought, of walking around and talking with people has never really gone away. We're in 7,400 square miles of the Adirondacks. So we're only in New York. So it's super easy for me. I can get to any health center. The farthest one away is close to Canada in Champlain. But I generally will travel with a regional manager or a chief operating officer or a practice leader, so that I get one-on-one time with that person while we're traveling.
Sure.
And then we talk about the health centers we're going to go to. And I make it a point to spend more time going to health centers with no agenda than going there for employee relations issues, to your point, because I think they really do view us as a resource, and employees come to us with that mindset. They're not afraid to come. And so when I go, I will walk around, I'll talk with people, I'll notice things. I'll be like, oh, that chair looks like it's broken. And, oh yeah, well, we can fix that. We can, get you a chair. Or sometimes it's a bigger thing, saying, geez, have you thought about, adding bereavement for a dog that's passed away? Or have you thought about, creative solutions on things that they're weighing on? So it's always listening and making time and just sitting with as many employees as you can. And they feel comfortable when I go into the health center. They all know me. They all will chat with me. Sometimes we'll bring a bushel of apples. Sometimes we'll bring snacks. And so they welcome the visit. So that's one vehicle of going around. And then the other way we listen is employee engagement surveys. We use Press Ganey, which is specific to healthcare. We take it really seriously. We dive down into anything that's brought up. We respond to it, and we have really, really high scores to the point where Press Ganey is like, wait, are these right? They're like,
Real?
because we really do care, and then we make changes, and we do a simple employee net promoter score every 6 months. It's easy. Anybody can do it through SurveyMonkey. You ask one question: would you refer a family member, friend? Those are also super high on a negative 100 to a positive 100 score. We're generally in the high end of that. So it's just a indicator, but it's a pretty good indicator of how people are feeling. So there's multiple touch points to hear people, and then being open to being creative where you can. And I think the pandemic helped everybody be really creative, because we had to get telehealth up, and we had to get people home, and we had to do all those things. So I think listening is one of the most important things you can do, and then act on what you can act on.
So I want to build on that, because you mentioned employee engagement. And so you said that you do measure it. So what are you measuring, and what should an organization consider measuring if they've never done this before? One, what would be your advice on first rolling out an employee engagement survey? And then number two, what should they be measuring?
So the way the survey companies, Press-Ganey isn't different. They have long surveys, they have shorter surveys, and then they can tailor them. So for us, we were really focused on burnout of employees. So, we're in healthcare and that's easy to do. We also were really focused on people's happiness, their well-being. Do they have time to exercise? Do they have time to be with their family? Do they feel supported? Do they have all the tools? So everything they need to do their job to be successful, how they feel with their coworkers, their supervisors. So anything that touches them related to work and outside of work, we wanted to know about, because we made decisions on how we put our benefits in, how we do time off, and actually how we function in our health centers based on the feedback. So when we first did the survey 5 years ago, we had really good results, but one thing was the providers didn't feel like they really had a balance, right? Because they're doing bucket work, which is going through their charts on things they have to clean up. And so we said, well, let's go to team-based care. Team-based care is the theory of you put a team of people together. One's a lead provider. They're working on all of those scripts or referrals or all the bucket work during the day while everyone's seeing patients. So at the end of the day, no one has to bring anything home. So it was just a nice, so now we do feel like we've gotten balance for people and that they have time, because we really, really want them to be healthy and happy, because ultimately that's what we're here for, is to make people healthy. And that's not just your benefits package. It's everything that goes with it. We heard tuition was a big deal. People had a lot of tuition debt. We've paid over $4 million in tuition debt off for our employees, regardless of what their education was in, because that just weighs on your mind and it makes it hard to, and it's like, the tears when people would get the checks and that, about 50 of them fully paid off their debt was just like, you can't put a price on, how that impacted their health and their well-being. So
Sure.
Some of the things.
So can you talk a little bit about, we see it in the news, we see the struggle that's happening right now. I see it when I talk to my clients on a daily basis, the struggle of the people who have the privilege based on their job to be able to work from home, to the industries and the jobs that just require people to be on site. And obviously in healthcare, there is a telemedicine element that's there, but not everything can be done through telemedicine. Just like I always say, driving a truck cannot be done through the computer. You have to be sitting, right? At least for right now, you have to be sitting behind the wheel of that truck delivering goods. So how did Hudson Headwaters tackle that? Give people a sense of some type of balance, maybe flexibility, or what did you do as an organization to try to combat that in a way so that it wasn't, people didn't feel negatively about the fact that they really did need to be on site for their job. They couldn't work remotely.
Yeah. So we predominantly have had all employees in their work areas through the pandemic. So of the 1,000, 700 wasn't an option, right? They had to be in the health centers. And quite honestly, we were on the forefront and we were asked to lead it by many governing bodies picked us as the site for testing and vaccines and all that kind of stuff. So for us, it really felt like, in a weird way, even though it was a pandemic, the team all formed and came together. And it was like a series on MASH, where you have this influx of stuff coming at you, and then you're asked to do it. So it brought a tremendous amount of camaraderie with the team. Said, Hudson Headwaters, we're going to do this. For everybody, and it wasn't just the people in the health centers. But we did initially get everybody that could work remotely, working remotely when it first started. And today we still have probably 60 people fully remote. We have about 100 that are hybrid, and then the balance are in the health centers. And I think we just communicated, and because we're in the health field, like they understood the reason to having people not be here and to try to stay protected. And they also, you know, when you're in healthcare, you know, you sign up to be to do it. So I think we've balanced it nicely, and it hasn't been a sticking point for us. I haven't had a physician say, well, why does, you know, this person get to work? Like, they get it. And it is, you know, a lot of education, and it is the way the world has gone. And even we learned, wow, we really can have all of our revenue cycle people work remotely. So we save real estate space, we can rebuild and make better areas for other folks. So I think it worked really well for us. I do feel for my colleagues in HR that had different dynamics, and they sent everybody home. And then when they tried to bring people back, they said no.
Yeah, that's right.
We didn't have that.
Yeah, because that's what I hear sometimes, is that push and pull of an organization that has roles that must be on site and roles that don't necessarily need to be on site. And is there any infighting between the two? And you mentioned that it didn't really seem to be an issue. Do you think that comes back to the culture that you'd already established within the organization, or perhaps you mentioned just briefly about transparency and communication?
Yeah, I think it's being transparent. I think it's part of our culture. I will say we're still navigating the hybrid folks, because for whatever reason, people will say, they'll come in and they'll look for someone on my team. And if they're remote, I'll say, oh, he's working remote today. And they go, oh, well, when will he be in? So they've translated that I'm not to bother him. I'm like, no, you can call him. But that's something I think we struggle with, and other people. I find myself doing it. My director of HR was working remotely yesterday, and I'm like, oh, I got to talk to her. I'll just wait till tomorrow when she's in the office. And it's like, so I think there's some kinks there to work out, because, and there's something to be said when you're not here and you miss the hallway conversations and all that. So there is a reason we built buildings to have everybody come to. Yeah, we did find value in it. And I do think there's value in it, but I also think it's been incredibly valuable to help people save money on gas. It might have helped in some regards relative to caring for family members, whether it's children or adults, because that's a big issue as well. So it's had a lot of great benefits, but I think we're still navigating through some of those pieces.
One more question about this. Are you able to, or have you come up with any creative solutions for those on-site folks to have more flexibility, or things that just help them balance a little bit better? Like you said, you know, healthcare, childcare, or family care issues, or whatever it might be. Have you been able to do anything like that? Or how do you incentivize those on-site people, aside from they just, you know, love their job and love working for Hudson Headwaters? I mean, it sure helps have some incentive, right? Yeah.
So we do a lot of things around healthy foods and food for medicine. So we deliver gift baskets seasonally. You know, every employee will get one here. So there's the benefit. Like, the people that are remote, they can get one, but they have to come into the office if they want. So there's the flip side of that. We do a lot of great things and deliver things to people. And thank you. And then we look at, okay, we did through the engagement survey, we learned so many of our employees are also caregivers for elderly parents or children, and how taxing that is. So we partnered with the COM app. So all employees now have the COM app. They can share it with 5 family members and friends, because we realized, you know, during lunch and learns, it's really not practical for our physicians and nurses. Yeah. And I quite honestly, I don't know if they're practical for anybody, because people, they want to do them when they want to do them. Right. So the COM app allowed that. It's guided meditation. It's calming music. It's reading books to your kids. It's reading books to you. And so that has been hugely popular. And then the next piece we're adding with Archangels out of Boston is a platform called Truility. And Truility is a resource that people that are giving care to folks to get real life answers. And then when they need to go further, for example, if my 93-year-old mother suffers from some dementia and go through that sundowning where they're a little off at like the 4, 5, 6 o'clock at night, you can go to, and there's real resources that say, here's some techniques to help with that. And here's when you need to go to see a provider when you need help. So giving them those resources to mitigate the stress of those things that are both internal and then external things has been really, really helpful.
Very good. So let's talk just a little bit. We have a few minutes left. I would just want to say, if there is anyone that's watching us that has a question, you can certainly put it in the chat. I do have the chat up so I can monitor that. But just wanted to throw that out there. So one of the things we talked about was retention. Does retention equal success? And on the flip side, turnover, how do you accept it? So in your experience with Hudson Headwaters and other organizations, I was thinking about this the other day, Sue. You and I have known each other since like CDPHP days.
I know.
It's a long time.
Long time.
Holy cow. I don't know. I'm not going to see how many years it is, but that's a long time.
It is.
But so talk to me about how your organization and you view retention and turnover and, as that being part of the business.
So for years, people spent a lot of time on turnover, maybe rightfully so. I think there's factors that happen sometimes that are out of the control, and it's not as important to measure. We have focused most recently in reactive to the market on the stop starts that seem to be shorter. So the 90-day piece is where we've focused on, because we do have a significant number of long service employees. And we know after they've been here a few years, they generally stay. And if they leave, they generally come back. I just had an employee who had been with us for a very long time. She left because she wanted something closer to her home, which made sense. She came back after 10 days. She's like, I didn't realize it's far better to have a long commute for a job you love than a short commute for a job you don't.
And that was after 10 days.
Yeah, 10 days. She's back.
Mm-hmm.
Priscilla's back. So
wow.
We're happy. So I don't do measure turnover. I do it to solve for problems. And what we switch to, instead of managing year over year of turnover, because ours tends to be lower than most in healthcare, but the introductory, the first 3 months, 6 months is higher. And so that's where we're spending a lot more time focusing on how we're recruiting, what did we miss in an interview, how do we make them successful, and then it's evolved into saying, I know you're short-staffed in something, but you can't compromise training. So we're figuring out how do we set up an educational institute so that they don't get caught in a fray of being left on their own after a week or so. And that's more valuable to me, to look at what's happening in the market. And because if we all just measure the same things, we're all having the same staffing issues, it's just a number. I'm more cared about who's here, who's happy, how are we taking care of them. There's some normal turnover that people are relocating to a different area, their spouse is relocating. And then, if they're unhappy with something, we do our best to fix it or move them to a different location or a different role. We don't take resignations ever lightly. And we spend all our energy on how do we see if they will stay and what we can do. And if we can't, and they're a good leaver, you're welcome back anytime. And we have the good fortune of bringing back people all the time.
It's interesting that you mentioned that in the few minutes that we have left, because I've been, an HR practitioner for about 25 years. And I remember a time when if an employee left an organization, you were basically persona non grata going forward, right? It wasn't even a consideration. So, but I think the reality of the situation is now we have everything from, we just have less population. People are worried about these workforce gaps and skill shortages. And we seem to focus more on retraining or reskilling, but we forget to focus on the fact that there just isn't as many people around as there once was.
True.
A long time ago in other generations. So talk to us about the benefits of bringing back an employee who may have left the organization, so that if someone on the call is thinking, we don't have that policy. We don't let people come back. Perhaps maybe you can persuade them to potentially take another look at their policies.
Yeah, so the folks that tend to leave, right, if it's a nurse and very rarely a provider, most of my providers stay for life. We have a really unique, great recruitment engine there. But when they leave, and they're not leaving for the wrong reasons, they're going because the hospital can pay more. They have all of these, mandated overtime. They have all these other things, same with nursing homes. So they usually leave because financially they can make more money. They usually come back because they have no balance of life. And to me, if they go to the hospital or the nursing home or even another healthcare practitioner in our community, we all win because they're staying in our community. We need the hospital to be staffed and successful. So if people come from there to here or vice versa, why wouldn't you want to bring people back? Because they're in different places in their lives. So a lot of the young people are chasing the, traveling nurses and that all the money they go, and good for them. That's great. They're getting great training, but we'll definitely take them back when they're ready and they want, Monday through Friday, 8 to 4:30, and they want a regular life.
Yeah.
So I think it's short-sighted not to bring people back. And even sometimes people that have been terminated prior to when I was here, I would be open to looking at, well, what was the circumstance? And were they a good employee, but we let them go because of an attendance policy? No, and guess what? Their kids are in, middle school or high school now.
Yeah.
I think you should always look at the person and don't just make a unilateral decision, unless they stole from you or something like that.
Of course, absolutely. No, I always tell employers that, they could have gained new skills that now you can take advantage of.
Yeah.
They have the legacy knowledge from when they were there before. Yeah, there might be some updating and some things that have changed, but sometimes that core focus or that core foundation is still there because it's just, sometimes it's like riding a bike and you're like, oh yeah, I remember that when I was here before, those types of things. Right. So I think it is definitely in an employer's best interest to consider that. And I actually love that you are looking at things like, okay, was it an attendance issue? Was it something that was, a policy enforcement rather than that, other reason to bring them back?
Right.
Because again, you're right. Life changes, circumstance changes.
Yeah.
Kids grow up and don't have, a runny nose every day for 6 months out of the year.
Right.
Off season, all of those things. So as we wrap up, what if I were going to ask you one last question about culture, and let's talk about it from a standpoint of why is this important? Why is culture in an organization so important? Because I think, there may be some people that are like, yeah, everybody talks about culture. That's the trending thing right now. So, we have to have a better culture. But reality, talk to us why, if you were to say to somebody why culture is so vitally important to an organization's health, what would you say about that? And then it looks like I have a question for you after that.
Yeah. So to me, having a culture of caring about the entire person is the most important thing to be successful in any organization, because if they know you care about their entire well-being, they have a family because they like them and they want to spend time with them, they want to get a lot out of what their work is. If you can hit all of those things and you can influence their stressors with debt, with food insecurities, with housing, daycare, like all those things, you're going to improve the health of that person, which ultimately is the goal for anybody, to have good health. And I think it is short-sighted and I worked for a British company for 20 years, and, it was great in many ways, but it was really easy to work, 15, 20 hours a day when there's someone always awake within the corporation around the world. Yeah. And there was the taking advantage of people, and you just did it back then. But I think it's kind of nice that people have said, oh, wait, I don't want to do what my mom or my dad or whatever did. And we're learning what the benefits from it. And, Henry Ford, everyone complained Henry Ford, he came up with a 40-hour work week. He got all the farmers, that were working the fields and said, hey, stop working those 12-hour days, come work for me, and you can do 40-hour work week. And it was genius at the time, right? Oh, it's a regular day, you get the weekend. But we haven't progressed from that. I really think we should be looking at what is the right balance and forget the hours thing and figure out, because, trusting people, having trust and knowing that you're going to take care of them, they'll take care of you all day long.
So that it's like it was like scripted, and I promise it wasn't scripted into the question that was asked, because it's like so in line. But I want to ask you, you always say something, you've said it to me, you said it to the different networks that we're a part of more than once. And I'm going to say it wrong, so I want you to say, but something along the lines of the most unequal way you can treat people is to treat them all the same, something along those lines.
Yeah, the equal treatment of people is the most unequal thing you could do, because everybody is different. Everybody's motivated differently. And if I ask 100 of my employees, what do they feel is the most important thing for them in their role in working here, I could get 100 different answers, and they're all right. They're all right. So I think figuring out how each person is motivated. I know I have people with young kids, so it's super important for them to have flexibility to get to the concert or the soccer game. My kids are grown and gone, so I can cover for them, and eventually they'll do the same. They'll pay it forward. So I think, figuring out what every person is wired by. Some people it's bringing in bagels, and that is like, or it's their birthday, or they don't want big recognition. They just want more time off. And if you figure out what helps that person, it comes back in spades.
Absolutely. It's so funny you mentioned bagels, because today is bagel day at my husband's work. He literally got this morning. He's like, today's Wednesday, it's bagel day. So one of the question here was, many of our Medtech members companies are running manufacturing sites. And are some of the things that you've talked about that might be different when you are looking at running a 2-3 shifts per day type situations?
So I worked in med device.
Yep.
At the time it was Navilis Medical. Before that it was Boston Scientific. Today it's AngioDynamics.
Yep.
And we did have manufacturing that was going 24 hours. So I would very much do similar things. I would go in at all the different shifts and listen. I actually worked the line, which I don't know who that was a good idea. Going to clean room manufacturing, but we were in a backlog. We had switched EMR systems, but I think it's still the matter of listening and figuring out. It's very similar. You have health providers. They can't just walk off and go for a walk in the middle of the day, same as people working on the line, but you still can give them the baskets of fresh fruits and vegetables. You still can listen to them and figure out what would make their day better. And do, there's similarities, even though they're not tethered to the clean room. They're tethered to the patient schedule, and there's not a lot of room to do it. So there's always a way to listen and reward and figure out how do you engage and keep them happy. Because working the line, that's hard work. And the dexterity someone needs to have to do, and to do it, the repetition of it. But, you can get great people that stay for life if you treat them well.
Absolutely. Definitely. And I think that's right. It comes back to that. So I always find that, and I am making a very broad and general statement, so I want to preface it before I say it, but the reality of the situation is that to create a good culture, to create a good leadership group, to create all of the things that, keep your employees happy, it takes work. It's that's what a manager's job is. It's to create an environment, provide the tools, provide the flexibility, availability, whatever it might be, so that employee is happy. And then that in turn is how your company will be successful, because you have a happy employee. It's no longer the what's in it for the employer. It has to be what's in it for that employee. And if you can figure that out and make that happen, the company's going to be more successful. It's just, I just think it's like logical math, really. Yeah. But I think it's a mindset that we're still shifting and changing.
Yeah. Definitely. Yeah. And I think that's key. You have to constantly change with it. Like I can't do what I did in the past, nor do I want to. I've always wanted to be the employer of choice, and we've gotten there, but it's always a work in progress.
Absolutely. Well, Sue, thank you so much for your time today. I really appreciate it. I'm going to just one more chance for the people that are on to ask any last minute question. Please feel free to throw it in the chat. I'll give it another minute. But at the same time, Sue, I just want to thank you for doing this.
Yeah, my pleasure.
And for the slight technical difficulties. This is the first time we've ever used this platform. So learning curve for us as well as we do future webinars. But again, thank you so much for everything. Keep doing the amazing work that you're doing. That's why I wanted to have you on, because I've just been personally impressed as, she's my go-to for best practices in this space. So I just wanted to say thank you so much for joining us and giving of your time and your advice today.
Yeah, thank you so much for having me. I really enjoyed the conversation.
Awesome. Wonderful. Doesn't look like we have any other questions. So I will say thank you to everyone who joined us today. I really hope you got something out of this. If you'd like to see some type of topic in the future, please certainly reach out to Alaant. We would be happy to try to arrange something like that. And again, I thank you for everyone who joined us today, and I hope you have a wonderful rest of your week.
Bye, everybody.
Bye.